This is lecture 4 of Rehabilitation Counseling Theory and Practice 2. We'll be discussing identifying and setting counseling goals, which is stage 3 of the 4-stage counseling process. Thus far, we've talked about establishing the working relationship. Stage 2 was focused on assessing or defining the presenting problem. And stage 3, which is where we currently are, will focus on identifying and setting counseling goals. The objectives for this class are to identify the stages of change. We want to examine the process by which the counselor and client collaboratively develop counseling goals, and we want to understand the client that is in crisis. Prochaska and DiClemente are the founders of the Stages of Change model. And it's important to understand the stages of change because it gives us an understanding of the process by which our clients evolve from where they currently are to where they might need to be in terms of behavior change and growth. And as it relates to the stages of change model, it begins with the pre-contemplation stage. And at this stage, the client is not ready to acknowledge that there is a problem or behavior that needs to be changed. Most often when we receive clients that are in the pre-contemplation stage, it's usually a court-ordered client. It's someone that will come to us because they're mandated to come by the court of law. They don't come of their own will. So oftentimes, if we have a client that is in the pre-contemplation stage, they have not yet acknowledged that there is a problem behavior and that there is a need for change. It's usually the court of law or sometimes even family members that are mandating that they seek treatment. In the contemplation stage of the stages of change model, there is the acknowledging that there is a problem, but the person is not yet ready or sure of wanting to make a change. The individual is at a place where they are just kind of wrestling with some of the issues that exist with regard to the behavior. They are still sometimes information gathering, and so you might have a client that might contact your office or might contact you in a professional setting and want additional information. Because they are not yet at the place where they are committed to making change, but they are in the information gathering or the contemplation stage of change. And lastly, preparation and determination, which is the 3rd stage of the stages of change model. And it involves getting ready to change. Usually the individuals will set a particular deadline. They might say on January 1 is the date that I'm going to begin the new change. And if you think of New Year's resolutions, they usually begin on January 1. And so that is usually the point by which an individual will decide this is when I am going to make a critical change. And so the person is making preparation. They have maybe discarded their cigarettes if they're going to quit smoking. They may have decided that this is the particular date by which I'm going to move out of my present situation and move into a different situation. It also might be the date by which someone might begin a treatment program. They might decide that that is a particular point by which behaviors change. And so when we look at the stages of change model, it really was devised for people that are in recovery, specifically persons that are in substance abuse recovery treatment process, and recognizing that there's the pre-contemplation, the contemplation, the preparation, and determination. But once the person has made the change, the other important consideration is the maintenance phase. And so continuing, looking onward, there's also the action or willpower stage, and that involves the changing of behavior. The individual recognizes that there is a need for change, they have collected the relevant information, and then they are at the stage where they are changing their behavior. So that is the action stage of change. That is also where willpower is very important. For those of us that might have tried exercise programs, and we're in this exercise program, and it usually takes willpower to stick with it and overcome the challenges associated with it. And in like manner, it is also the time at which a person that is in treatment, if you will, if you think about someone that is going through substance abuse treatment, it is when they're in the action phase, where they are actually going through the behavior change strategies and making sure that they stick with the program and matriculate through the end. And once they have successfully completed the action phase of the treatment process, they are then in the maintenance stage, which is something I mentioned just briefly before. They're in the process of maintaining the behavior change. And as we know, it's easy to begin the change process, but it's committing oneself to changing, and usually it's a lifestyle change, changing the lifestyle and maintaining the behavior change. Sometimes in the stages of change model, there is relapse. There is the time at which the person returned to old behavior and abandon new behavior. And when this occurs, then most likely the person is encouraged to start the stages of change model at another phase. Sometimes it involves the preparation or even the contemplation, looking at what has happened, acknowledging that there are certain limitations that they are at risk for. Then they must go into making preparation. Again, there's the action phase. Sometimes there's additional treatment. And again, they're in the maintenance phase, or the phase whereby they must maintain sobriety. So when working with a client, irrespective of what the behavior change is, whether it's issues related to substance abuse treatment or issues related to job placement, or it might be mental health counseling, it's important to assess where they are in their stage of change, because oftentimes where an individual is in their stage of change, there are issues related to it. There are certain preconceived attitudes or beliefs associated with their stages of change model. So when working with a client, it's also important to quickly and efficiently assess where they are in their stage of change, whether they are committed to the stage of change process, whether they are contemplating still, or whether they are wholeheartedly seeking the changes that are needed in order to evolve from where they currently are to another place of their growth and development. So just to review, the stages of change model that was developed by Prochaska, Necross, and DiClemente back in 1998 involves 6 stages. And the first stage is the pre-contemplation stage, where the person is not yet acknowledging that there is a problem behavior that needs to be changed. Second, there is the contemplation stage, where there is the acknowledging that there is a problem, but the person is not yet ready or sure of wanting to make a change. The third change stage is the preparation determination stage, which involves getting ready to change. The fourth stage of the stages of change model is the action or willpower stage, and it involves changing one's behavior. Then the 5th stage of the stages of change model involves maintaining the behavior change. And lastly, it's always important to consider the relapse phase or the relapse of a person that's in the stages of change, and that is when the person returns to older behavior and abandoning new behaviors. However, it's important to reconnect the person in the earlier stages of change and get them to work toward the recovery process. So why are goals important? We've talked about in lecture number 3, we talked about the importance of information gathering, either in the initial intake or the history gathering. We talked about identifying the problems and understanding what the primary goal is, what intermediate or immediate goals that exist for the client. And once all of this germane information is collected, then we move to identifying the important goals. So the question becomes, why are goals important? What we know is that goals give direction and assist in moving in a focused direction with a specific route in mind. Otherwise, without goals, we are oftentimes aimlessly wandering through the treatment process. Thus, it is really important to give direction and assist in moving in a more focused, directional fashion, and goals allow us an opportunity to do this. It's also important to reflect what the client wants to achieve, and goals give us very clear, concrete, objective, measurable ways by which we can achieve the stated objectives or goals of the client. And also, goals are important because with the counselor's help, the clients are able to identify specific ways to resolve issues, as well as identify courses of actions for problem resolution. So goals are important, and if we think about the significance of goals in our own lives, we know that when we have goals, it helps to organize our thinking as well as our behavior. Goals help us to achieve our objectives. And I'm a firm believer that not only having goals, but placing goals where you could see them on an ongoing basis ensures the likelihood that you will reach those goals. In addition, it's important that we set timelines, because when we work with our clients, we know that we don't have an extended amount of time to work with our clients. Usually we are very time limited, and so goals also help us to ensure that we reach our objectives within a limited amount of time. And as I stated in lecture number 3, that it is important that we have no more than 3 goals at a given time. There are 4 important functions of goals. Goals provide us with a motivational effect. Goals serve to motivate us and to catapult us into action. Without goals, oftentimes we are wandering aimlessly. But with goals, we are more motivated and we're more goal-directed or objective directed. So goals provide a motivational effect. We also know that goals serve an educational function in counseling. Goals help to orient a client on how to move from one point to another. So one of the things we know that is, in order to achieve goals, there are the immediate issues that must be addressed as well as the intermediate issues. And so the educational component of goal setting is it helps clients to understand, even in other contexts, that in order to move from one point to another, that goals must be in place. They must be action oriented, they must be measurable, and movement is required. So there is definitely an educational component. It helps the client to see the trajectory that must be accomplished in order to move from one point to another. In addition to goals providing a motivational effect and an educational function, there is also an evaluative component associated with goals. Goals provide us with an opportunity to quantify and objectively discern whether or not the stated goals have been achieved. It allows us to evaluate whether there has been success in moving from where we were to where we would like to be. Without goals, it becomes a very fluid process. So it's important for us to recognize that with our goals, we must have objectives that are clearly stated, that are action oriented, and that are behavioral. And when we have these sequential objectives that are observable and quantifiable, it's easier for us to discern the extent to which the goals have been made. And once we are able to obtain this information, we can make alterations. We can decide what additional work is needed in order to achieve the goals that are established, what other kinds of resources, what other kinds of services that are needed to move the person forward, particularly in instances where growth and movement is stymied or limited. The fourth important function of goals is that it is a treatment assessment function. It allows us to assess treatment outcomes. It gives us information on how likely a person has been in going from where they were to where they are. So it allows us to assess the effectiveness of a given treatment in helping an individual to move from one point on the continuum to another. So just as a brief review, goals provide four important functions. First, goals provide an informational effect. Goals provide an educational function in the counseling process. Goals are evaluative in the counseling process. And lastly, goals provide a treatment assessment function in counseling. There are parameters that exist within the goal setting process. And within these parameters, there are process-related goals as well as outcome goals. And process goals are related to the establishments of therapeutic conditions necessary for therapy. Process goals are more of the intermediate goals that must be in place. For example, an immediate and intermediate goal of the process is establishing rapport. We know that on the front end of the counseling process, we must establish rapport, we must establish a relationship. And this happens not only at the beginning of the process, but it continues to grow and build throughout the therapeutic process. So it's important to understand that with process goals, they are ongoing. They happen throughout the therapeutic process at the beginning, and it builds throughout the therapeutic treatment. Also, process goals provide a non-threatening setting. Not just the first day that the client comes in for treatment, but on an ongoing basis. We want to produce an environment or a therapeutic condition that is non-threatening, that it's warm, engaging, where the client feels comfortable sharing information. We want to ensure the client's autonomy and confidentiality so that when they come in for treatment, others within the waiting room are not aware who our clients are. Because one violation to a client's confidentiality is having other people be aware that they are receiving treatment. And this is especially important in a rural community where you're more likely to know the persons that might be waiting for the next appointment. So we want to ensure that among the process goals that we are establishing rapport, and we also want to make sure that we are providing treatment in a non-threatening setting that respects a client's confidentiality. Another important part of the treatment process is to ensure that we are possessing and communicating accurate empathy and positive regard. And if you think about putting yourself in the place of a client, who among us would want to go to a treatment facility where we are not warmly embraced, where we are not feeling as though the counselor has an understanding for our life experiences and an appreciation for what we have gone through, respect, positive regard. So it's important that as counselors, we convey to our clients that we are empathic, that we are genuine, that we have positive regard for them as human beings. And we want to convey this not only verbally, but through our nonverbal communication. We have to be warm and engaging. And these are things that you just have to, it's a part of who we are, it's a part of your being. You must be interpersonal, you must be engaging, you must be warm and trustworthy, inviting. And this is especially important if you are in if you're a professional clinical counselor and you offer your services on insurance basis or a fee basis. Clients are unlikely to come to you for services if they do not believe that you are empathic, that you possess positive regard, and that you are genuine, and that you can connect with them on a human, interpersonal level. So just as a review, the process goals relate to the establishing of therapeutic conditions that are necessary for therapy to take place. And in order to build the therapeutic alliance that is needed in the therapeutic context, we realize that we must establish rapport, provide a non-threatening setting, and possess and communicate accurate empathy and positive regard. Additionally, there are outcome goals that are very critical to goal setting. And outcome goals are directly related to those life changes your clients hope to accomplish through the counseling process. Our clients expect that on the end of the counseling process that they will have a changed life that is enhanced, that they have the skills and tools needed to positively impact those issues that have been troublesome in their lives. And so clients are expecting outcomes. And in order to achieve the outcome goals that are expected, we must definitely have a positive working relationship or the therapeutic alliance that exists between the client and the counselor. Goals may be modified through a better understanding of the problems. On our previous lecture, we talked about how as we get to know our clients better, our clients get to know us, our relationship is enhanced, the trust is deepened, our clients are sharing more detailed information about who they are and what their life experiences are. And as the relationship is enhanced, clients will share additional information that may not have been shared during the initial intake session or the history gathering session, because oftentimes that occurs at the initial session, the very first session. So as the relationship evolves and grows, the client will share deeper and richer information with you. And it's through this deeper and richer information sharing that you have a even better understanding of who your client is and what the problems are. As such, when you have this deeper, richer understanding of your client, and you have a better understanding of their problems and their life experiences, we must also make modifications to the goals that have been established. And this is done through the development of, as we stated, new attitudes and behaviors that will eliminate or reduce the problems. So as we obtain this new, richer information through this enhanced, deeper, trusting relationship and alliance that has been formed and is constantly evolving, we must also modify our goals that have been established with our clients. So outcome goals directly relate to those life changes your clients hope to accomplish through counseling. And we also know that outcome goals may be modified through a better understanding of your client and the presenting issues that they are dealing with. And this oftentimes occurs through a richer, deeper, trusting, evolving relationship with our clients. Also, outcome goals are visible and observable, and they are far more useful. So process goals are important. They are essential. We cannot do the work that we do with outcome goals without a strong foundation. And the foundation is laid through the process, through rapport building, through developing the therapeutic alliance. But the outcome goals is really where the rubber meets the road. Those are our more visible, quantifiable, observable behavioral changes that are needed in order for our clients to evolve. And it's through the obtaining of these goals that we reach the termination process. That's when we are ready to terminate our client and allow them to move on, because they have reached their goals that are visible, observable, quantifiable. When outcome goals are stated precisely, both the counselor as well as the client have a better understanding of what is to be accomplished. So it is important that our outcome goals are very precise, they are quantifiable, they are observable, they are visible, and they are also sequential. So when our outcome goals are stated precisely, both counselors and clients have a better understanding of what is to be accomplished. It gives us our blueprint of how to move from point A, which is where the client is when they come in for treatment, to Z. So it's our A to Z blueprint on how to move the client from one point to another. Also, our outcome goals provide counselors with a better position to select appropriate interventions and strategies, and for assessing progress. So for us as counselors, we talked about the blueprint, and for counselors, our clearly stated outcomes allow us to not only select the best intervention, but also the treatment strategies to move from point A to point B. And it gives us the ability to assess the extent to which the outcome goals have been measured. And remember, we already said that the outcome goals are observable, they're measurable, and they are quantifiable. And so that is the assessment part of the outcome goal process. So So we've talked a lot about the importance of both process and outcome goals. We know that the process goals are foundational. It's important to building the relationship and building the therapeutic alliance. We know the critical importance of outcome goals and the importance of how goals play into our treatment interventions, our strategies, and our ways of assessing the extent to which the client has moved in the treatment process. We know that outcome goals also identify the behavior to be changed. So what exactly do we want to change? What is the behavior of primary focus? What is the target? Also, we know that outcome goals identify the conditions under which the changed behavior will occur. Will it occur in a treatment facility? Will it occur through bibliotherapy? Will it occur through intense one-on-one therapeutic treatment? Will it occur through involving family members? Will it occur through identifying and connecting the client with essential resources that exist within the community? So it's important to understand the conditions under which the changed behavior will occur and what is needed in order for the behavior to take place. Is it job placement skills? Is it work hardening skills? Is it training skills, academic skills? These are all the conditions under which the behavior change will take place. And sometimes, as we know, as counselors, whether it be rehabilitation counselors or mental health counselors, sometimes the changes that we expect to see in our clients exist through resources outside of our offices. And that's why relationships, community relationships are really important in terms of making sure that our clients receive the necessary services that are needed in order to bring about the behavior changes that are required and expected. Number 3, good outcome goals also identify the level or amount of change. And if you think about it, all 3 of these issues are objective, they are observable and quantifiable. So it's the behavior that is to be changed, the conditions under which the changed behavior will occur, and it's also the level or amount of change that is needed. For example, on a level or amount of change is that we are expecting the client to be able to identify that they are no longer experiencing issues of depression on the Beck Depression Inventory. Or it might be that the client will obtain gainful employment and maintain employment for 6 months. Or the client will be able to have productive interpersonal relations with their family members as well as other co-workers in a healthy and non-threatening way. Or the person will be abstinent from substance abuse and alcohol use for their entire life, and this will be maintained through regular screenings through the necessary substance abuse screening offices. So it's really understanding the level and amount of change that is expected within our client. So in order to achieve goal setting, we know that there are specific skills that are needed. And again, verbal skills is at the center or the core of what we have to provide. Verbal skills are used to open and guide discussions about the client goals. Also, structuring skills are very important. As counselors, we must be able to use structuring skills to help the client formulate and capitalize on their life goals.